Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Annavadhas Vyadhi, and in that regards, in last episode, I had discussed with you Samprapti of the Chardi, and I had discussed purposefully that Samprapti in detail just to point out how the Samprapti of each Dantakar differs according to the cases seen by him. So we have seen that other Granthakar except Sushruta Samhita has mentioned Udanmayu Prakop, and Udanmayu expels the contents of Amashay through the mouth, and only Sushruta Samhita says that Udano Vyana Sangataha. And why this Upasthiti of Vyanayu, I have discussed it in last lecture. So whenever you will see the difference of opinion of anything, maybe Lakshana of Samprati Hetu in the decision of Vyadhi, you must understand that, or you have to keep in mind that first thing, why he has, that Granthakar has mentioned a different thing than others, first thing, and if he has described some other point which is out of the way, then it must be in relation with the patients the Granthakar had seen in their experience. So always remember, people criticize Ayurveda many a times that there are so many difference of opinions and there is no any uniformity in the decision of some principles. It may be a Sharirik Kriya or Nidan, Vyadhi, Chikitsa, anywhere. It is not that it is a difference of opinion or there is non uniformity. Each Granthakar has written their text according to their own experience of the patients they have seen clinically. So, whenever you will find the difference of opinion, always try to get that frame of mind of that Granthakar, and through that perspective try to analyze the decision given by each Granthakar. So you will understand that this is not a difference of opinion, this is the difference of experiences of the patients of each Granthakar. Now come to Chardi. Chardi as a disease, very simple to diagnose and even for the treatment. Still, it is very interesting for me because on the background of Chardi disease, we can analyze different principles of Chikitsa, and these each principle are altogether separate from each other, but they all are can be applied in Chardi disease. Let us discuss these principles on the background of the Chardi today. Now patient has completed with the vomiting and you have to control it. So what are the options if you have 3 patients of Chardi in front of you? The first patient is saying to you that, complaining you that I have only rullas, and if something gets vomited, I think it will be better for me. Second patient says to you that after I am getting vomiting, I have already vomited 2-3 times, but after vomiting, I am feeling better. And third patient says, I am vomiting tremendously and I am getting exhausted now, I can't tolerate. Now you have these 3 patients in front in your clinic and you have to give the treatment to them. So let us discuss each case and how the principle varies of treatment varies according to them. First is patient, what he is saying that I am getting rullas, vomiting sensation only, but I am not getting actual vomiting, and if I get vomited, it will be better for me. Now, in this case, you have 2 options, that either Shaman Chikitsa or Shodhan Chikitsa. Shaman means you can give the medicines and that loss is cured. Or if the dosha gati is urdhva gati, then you can give a boosting to this urdhva gati. So whatever is not coming out of the body, not getting expelled, will get expelled and patient will feel better. You will find many patients that they early in morning they induce vomiting, after vomiting they feel better throughout the day. So what is this? The principle of Chikitsa in the text, that those which are ukleshit and their intention is to get outside the body, then give them bala or induce that gati little bit more, so that gati will get expelled, the doshotklesha will be get expelled out of the body. Second patient is saying that I am vomiting and after getting vomited I am feeling better. Many times we see this in the case of amajirna or amajachardi. Now, what is the second principle? Those which are already utkleshita, already they are in utkleshit avastha, then never stop them. Why? If you stop in that particular condition, this dosha will create another disease because they are now not removed from the body. So उत्कृष्टान अधम ऊर्ध्वा न चामान वैते स्वयं धारे दोषरी दोषान विद्रुतास्ते रोगदः. It means उत्कृष्ट दोष, if they are already getting out of the body, then just ignore them. Just ignore them. Let them get expelled on their own from the body. So this is the second principle of the Chikitsa. And in third principle, patient is already telling you that I am already getting vomiting and I have exhausted. In that case, you have to give Shamana Chikitsa. Now, so these are the Chhardi is the common symptom or disease in all these three patients. In one patient, you have increased the urdhva and the vomiting sensation which was only up to sensation level, we have induced Chhardi in that case by giving the medicine which will get vomited. It's just like Vaman procedure. In second patient, we have seen the patient is vomiting and we have ignored and not have given any medicines, and we have convinced patient, let us wait and watch, let all the things which are ukleshit in the amashay get outside the body. And in third patient, the patient is having vomiting already and he is not now tolerating, you have interfered with the Shaman Chikitsa and stop the vomiting. So that's why this Chhardi example is very, very interesting for me, because you can analyze three different formats of principles of Chikitsa on the background of the one disease. Now, how you will choose whether to induce it, whether you have to just ignore it and observe the patient, and third, in which patient you will go for Shaman Chikitsa. This differential treatment will be discussed in the next lecture. Thank you very much.